So, very poignantly then, or relevantly, what role did Imperial College have and Neil Ferguson's work in modelling? Because that's one form of science, isn't there? There's all sorts of sciences, there's social science and political science, but that particular computer modelling science, what impact did that have in setting up this narrative and leading to lockdowns?
It had a huge impact, and for a long time, Imperial College was quite happy to promote the impact that it had. But we know that. So this was the modelling paper published on March 16th, 2020, and we know.
What did that say? That modelling paper?
Well, it predicted that 500,000 people would die in the UK without lockdowns, and it also
did it use the word lockdown? Or
no, I can't.
Doesn't
answer.
matter.
I can't. Yeah. I think it did. I think it didn't quite say that. I think it said without following the Chinese policy.
Yeah, which is good as. Yeah.
Yes. And that if a sort of the policies which the government were currently following would lead to around 250,000 deaths. So it was. So there was the sort of what they would call letting it rip, doing nothing. That was 500,000, 250,000 if current
some
policies,
mitigation measures
were taken, and then the lockdown policy.
Did they predict how many lives?
Now in that paper, they didn't, as far as I remember, predict the number of predicted mortalities, but very soon afterwards, in press conferences and press releases, they predicted that the lockdown measures would lead to 5,700 fatalities in the UK. There would be only 5,700 fatalities following the lockdown policies. And that they would be worthwhile, and this was the phrase used, it would be worth it if the fatality rate was under 20,000. Now, in the end, as we know, the fatality rate is somewhere in the region of, I can't remember what it is today, but about 170,000, yes. So, by any standards, the predictions were wrong. Now, of course, subsequently, Imperial College and the Ferguson team said that 20,000 additional deaths have been caused by not locking down earlier.
Yes.
But even if so let's accept that. But we can still see that we're talking about figures which are far lower than what actually transpired. So all we can say is that the predictions were false. We know that now, without a shadow of doubt.
Well, they would say, of course, they weren't predictions; they were just modelling estimates, and they weren't definitively. But
if that's the case, I suppose fair enough. But then, in that case, they shouldn't be as influential as they were. So
well, that's the point, isn't it? So governments could have chosen to take that as okay, that's helpful, useful.
Yeah.
Let's look at other areas of this whole debate, but they didn't. So why do you think that modelling paper not only was influential in the UK, but I think in your book you say it was influential in the US and other countries as a knock-on?
Well,
I mean, how could one institution with one particular examination of data have such a wide-ranging influence? Was it because there was nothing else and we were in the dark, or,
Well, I mean, I think there we're looking at the politics of science, right?
Yes.
And, what we know is, Neil Ferguson, while most people probably never heard of him before 2020, was actually, had been knocking around for a long time, had many roles. He had very senior roles in the World Health Organization, various modelling committees there. He was in receipt of a large amount of funds from a huge range of institutions.
Such as what?
Such as the Bill and Melinda Gates Foundation, also the Fauci's NIH, and he had many scientific contacts around the world.
So were there, and not accusing him of doing
the Wellcome Trust as well.
The Wellcome Trust, yes. So not accusing him of any bias, but do you think there were also vested interests within those funding organisations for a lockdown, potentially? Especially
I think I wouldn't use the phrase vested interest. I think I would say that there were interests. It's clear that...
And explain why. Why would the Wellcome Trust or the Bill and Melinda Gates Foundation have an interest in lockdown? Why would that be?
Well, they were very interested in pandemics. I mean...
But would there be a financial incentive to lockdown, for example?
I think there clearly were financial benefits in the long run for tech corporations such as Microsoft and for pharmaceutical corporations, and we've discussed that. But on the other hand, I think in terms of thinking about how the politics of science plays out,
yes.
what we know is that science has become very global. There are all these there are all these very complicated networks of powerful, influential individuals who have a lot of money both behind them, but also to give out in donations. And so I think that can help to understand why this paper was influential.
Yeah.
It was influential because of the way those networks had already developed.
Yes, I understand.
And what we know is, and it's not just Imperial who said it was influential. Deborah Birx, who's a very senior figure in the coronavirus task force in the US, said they took the lockdown policy because of the paper from Imperial. They actually was quoted in the Washington Post saying that.
Did the Imperial model also model what would happen in America? Or
was it was more. I think he made predictions about that, but it wasn't actually in that particular paper.
No.
Yeah,
but there were also predictions from.
No, in fact, what happened was that the American team, so Birx and her colleagues, drew on the Imperial model to make those predictions.
Reproduce it.
Yes, but then what we know, so that was March the 16th. A week later, March the 23rd, UK went into lockdown, and we know that was influential because the next day. India went into lockdown. Now, given the historic ties between the UK and India, and I've spoken to colleagues in India about this, and there was no mention or thought of lockdown.
No.
And suddenly President Modi announced it. That's what happened. And it's hard to believe. And I think partly maybe, there's also that, and this brings again the political dimension in, the idea that these are just scientific decisions. But of course, politicians, particularly those with an authoritarian bent, love being war leaders. Boris Johnson had just done this speech to the nation where he had announced, and he was suddenly, this was a war on COVID. Yeah. So a figure like Modi, well, it looks good. I can become popular by, being a war leader and doing the same thing.
There's a lot of war sloganing, we're fighting the virus,
we talk about that
invisible enemy.
Yeah, we talk about that in the book. And
but that doesn't explain Europe. I mean, was the Imperial modelling also influential across Spain, Italy, France?
I think it was less influential in Europe. It was more influential in the US, and I would say was very influential in what happened in poor countries, lower middle income countries.
But then, so Europe did its own thing by following China.
Well, Europe, and Thomas is, particularly strong in this because he's based in Italy, so he experienced this from the inside when Italy enforced. So it was the first country in the world, actually, because China hadn't enforced a nationwide lockdown. It was the first country in the world to enforce a nationwide lockdown, and that did spread very rapidly through, Europe. So countries like Germany, France, Spain, and if you remember, Lucy, I'm sure a lot of the criticism in the UK was precisely that we weren't following those models. That the UK initially did not follow those models that had been begun in other parts of Europe. So I think yes, the Ferguson model was influential in the US and influential, particularly I think in lower middle income countries.
Right.